Hi, Tom. How's testing in Waller? Sorry.
Vaccines.
I messed up already. Vaccines. Hey, Tom. How's vaccines in Waller?
Well, Ty, they're going great. Everyone's super excited now, and they're coming in because of the booster doses. But remember when we were doing all the vaccines and testing in Fort Bend County?
Oh boy, do I remember. Those were the days.
It's hard to imagine that we've made it to the point where we've done over 130,000 tests and 100,000 vaccines.
Those are huge strides that AccessHealth has taken to vaccinate the community.
As you know, there's a lot of things that we had to go through initially to get to that point, though.
Yes, remember when we were taking phone calls and using paper?
Thankfully, we were able to make some cool electronic tools to help speed up the process and make everything straightforward.
Yeah, those were very useful considering that we were taking 1,500 calls in a day.
Yeah, and remember, everybody was in conference room 3 to do all of that, but then we went to the admin building and everybody in admin was also a conference room staff somehow.
Yes, I bet they never thought that they would be call center associates. And remember during the winter storm, we had to do 1,300 to 1,400 vaccines in a day.
Yeah, despite all the cold weather and trying to get everyone jackets and just even trying to contact these people to come back in a couple of days for their vaccines, right?
Yes.
You know, a lot of good things have come up from the vaccine and testing initiatives, haven't they?
They have. They sure have. I appreciate, being able to be a part of this initiative. Imagine if AccessHealth wouldn't have stepped in and done their part to combat the COVID-19 virus. It would simply be miserable.
Or even all the information we were able to share with the community to make sure they were staying safe at home, whether if they were getting the vaccine or getting tested.
Yeah, during these times is when they really needed us, so I'm glad that we were there to provide resources. I really appreciate our staff members for stepping into the forefront and throwing themselves in and just jumping in and doing whatever it takes to help combat the COVID-19 virus.
And I know our friends over in Waller County can appreciate the same and our support within their community to get the vaccines and testing out to them. But frankly, I think our biggest thank you goes to our staff. Wouldn't you agree?
I agree. Our staff was amazing.
And whether you were on site or in the clinic or even in the admin building making calls on a cold January evening, we thank you for putting the extra foot forward to make sure we support our communities more than we already do.
You guys rock and you guys are amazing. And also a special thanks to our administration with proper education.
All the PPE.
PPE. Thank you guys for keeping us safe.
And on that note, there's still things we can do to keep ourselves safe. Make sure you wear a mask when you can, and also booster doses are available right now.
Yeah, I think I'm gonna go call Misty right now.
Yeah, and her extension is 3266 if you need one as well. The end.
Hi, I'm Charissa. I'm one of the clinical therapists here at AccessHealth, and I'm excited to talk to you about our self-care and mental health initiative that we're doing. Part of our self-care and mental health initiative follows the trauma-informed care policy that we're already trying to enforce. We as a company and a staff do so much for our patients. It's so important that we also take care of ourselves. So we've already talked about stress management, managing anxiety, and we've also had a race and mental health conversation. So not only are we doing self-care, but we're also talking about things that affect us in the community. I look forward to continuing this self-care and mental health initiative so that all of our staff can be aware of the things going on around us as well as what's within us. So please join me as we continue into the next year with taking care of ourselves as well as our community.
Hi everyone, my name is Sindhu Satish and I'm the Population Health Associate here at AccessHealth. Around 2 years ago, AccessHealth began our partnership with the Hogg Foundation for Mental Health and the Prevention Institute through the Communities of Care initiative. We began a community collaborative that's aimed at helping to support the Richmond community and working alongside local organizations and residents to help better the community's mental health and well-being. Earlier this summer, we began the Street Captains Project, where we recruited several resident leaders on streets in North Richmond. These street captains act as a liaison between neighbors and other local resources, such as the Richmond Police Department and several other nonprofit organizations, and they help to connect their neighbors and build a sense of safety and community-led change. Throughout this year, our street captains have participated in community-wide meetings, street walk events, National Night Out with the Richmond Police Department, and so much more. They're going to continue to do more with their neighbors and help promote healthy lifestyles and togetherness, which we truly believe will lead to improved mental health and well-being for the communities that we serve. We really look forward to seeing what our street captains do for the rest of this year and into the next one. Thank you.
Hello everyone, this is Dr. Daywalker, your Director of Health and Wellbeing. So back in 2020, you might remember we were all very worried and still are about COVID. And so was our leadership team. So it was discussed how we might support the staff during this time. You may also recall completing a health and well-being survey during that year with a follow-up survey completed this past July. What we found was through the trauma-informed care and our hero building initiatives that we were able to decrease staff burnout and increase mental well-being, which was a major accomplishment for our initiatives. We shared this data at the TAC conference in November, and this framework will serve as guidance for health centers across the nation, with HRSA starting to implement an annual health and well-being survey for all health centers nationally. So with that, I look forward to all the ways that we may continue to support you as well as the communities that we serve. Thank you.
"2021 marked the completion of our long-awaited Brookshire Expansion project. As the only primary safety net healthcare system in Waller, our commitment to providing high-quality healthcare to the residents of Waller and surrounding areas has been unwavering. Our long-standing and impactful presence in the community has made our clinical system a trusted healthcare institution in the area for 20 years. This August, we cut the ribbon on a new 12-patient exam room facility that will allow our team to serve the increased demands of the growing population in this community. We are committed to improving the quality of life for area patients by expanding our existing services and implementing programs that have already been successful in our Fort Bend clinics.
Hi everyone, I'm Taylor Tardy, a project sorry. I don't even know who I am anymore. Okay. Hello everyone, I'm Taylor Tardy, a project coordinator here at AccessHealth. We were able to host our back-to-school health fairs again this year. Unfortunately, due to the pandemic, this initiative was canceled in 2020. However, we weren't going to let it stop us this year. We kicked off with a back-to-school breakfast with the theme, Launching Healthy Futures. At this event, we hosted breakfast for our community stakeholders, highlighting the impact their donations have toward these health fairs. We featured messages from our community partners that work closely with us during these fairs and highlighted the impact this work has on the community. We are still dealing with COVID, so we knew we had to approach this event differently to ensure the safety of everyone involved. A drive-through setup was implemented, which allowed the community to stay in their car as we brought all the good stuff to them. Our Richmond Fair followed a winding trail through the community, led them past our clinic where the dental team was waiting with swag bags and informational packets, and ended at the Sacred Heart parking lot. Due to the new setup, our Missouri City Fair was moved from the clinic to the new Landmark Community Center. Families who attended the fair still had access to childhood immunizations, COVID-19 vaccinations, sports physicals, vision screenings, and over 2,000 backpacks and uniforms were provided over the 2 weekends. The back-to-school health fairs provide students with the essentials needed to start the school year off on the right foot. I'm grateful that we were able to bring this truly impactful initiative back this year.
I messed up. I didn't say it with it right. Dang it. Start over again. Come on, you got this. Okay.
You've got this.
Told you this was my thing.
You've got this.
Told you this was my thing. My name is Adrian, Director of Human Resources for AccessHealth. This year we rolled out the red carpet and implemented AccessHealth's DE&I program. The purpose in the program initiative is to guide our organization in promoting an inclusive environment, leveraging our diversity in support of the mission and the vision in serving our communities by providing integrated healthcare services. So why is this important? Ultimately, it's because AccessHealth is committed to fostering, cultivating, and preserving a culture of diversity equity, and inclusion within our team, our professionals, extending to those we care for throughout the communities we serve. We want the employees to know and recognize that human capital is our most valuable asset in fulfilling our mission and vision. The collective sum of individual differences, life experiences, knowledge, inventiveness, innovation, self-expression, unique capabilities, and talent that all our employees invest in their work represents a significant part of not only our culture, but also our reputation and achievement in caring for those that trust in us. We embrace and encourage our employees' differences in age, color, disability, ethnicity, family or marital status, gender identity or expression, language, national origin, physical and mental ability, political affiliation, race, religion, sexual orientation, socioeconomic status, veteran status, and all other characteristics that make our employees unique. AccessHealth strives to ensure an environment built on the premise of leveraging diversity, maintaining equitable practices, and fostering inclusion that encourages and supports respectful communication and cooperation between all employees, teamwork and employee participation, the representation of all groups and employee perspectives, employee contributions to promote a greater understanding and respect for the diversity in the communities in which we serve. All employees of AccessHealth have a responsibility to treat others with dignity and respect at all times. All employees are expected to exhibit conduct that reflects inclusion during work, at work functions, or on or off work site, and at all AccessHealth sponsored events. What excites us about this involvement in this initiative? Collectively, we're excited about the overall feeling of togetherness. The fact that each employee has committed themselves to DE&I and its best practices, clearly by the representation of their names outlined on their respective stars on the AccessHealth Star Walk of Fame. Also, that this will be an ongoing initiative to include various trainings, topics, and resources for all. The future for AccessHealth is bright. Thank you.